Hello, I'm Joan Justice from HealthWorks Collective and Social Media Today. I'm here with Felicity Knights and Holly Broadway from the Merchant Marketing Group in Southampton, UK. Felicity was the contact person for the recent live tweet during surgery at Spire Bushy Hospital, and Holly was the tweeter in the operating room. The hospital used the social app Vine to tweet 6-second videos live from surgery. This hasn't ever been done before in the UK. Felicity, you were the chief organizer for this event, so tell us a little bit about how the idea came about and how it progressed.
We actually had the idea to live tweet an operation about 2 years ago, but it's taken us quite a while to find the right team, clinical team and hospital team, and more importantly, consenting patient who understood what we wanted to do and achieve to actually get to the point of execution. So though I've worked with the hospital director and this particular hospital being retained as their PR agency for nearly 5 years, this is something new. And we started off initially just doing a bariatric bypass, a live tweet of that operation, which we did before Christmas. That went very well. So the next step was to do another live tweet, but using Vine. The hospital loved it, and the hospital director and the management team at Spire Bushy were very keen that we can innovate, and finding the right consultant and the clinical team who are comfortable with what we're doing, and of course the patient, was really the turning point for us.
Okay, and who was the chief promoter at the hospital? And how did you get him involved, or how did he get you involved? Was he the instigator here?
Well, we went to them with the idea, the hospital director, initially we went to with the idea, and he was very keen. Private healthcare has become very competitive in the UK, especially because of the changes that are going on in the NHS, and it's important for a hospital to not just show the clinical care and what it delivers in statistical information like patient satisfaction and cleanliness, to be able to provide an insight of what goes on in an operating theatre, the skill of the team, and show somebody what a surgeon like Mr. Arash Hashimi-Nejad can do with his team was really different and very important to the hospital.
Great. You know, this is a really major accomplishment, and I'm sure it took some time. Now, what were the obstacles and how did you overcome them? I imagine there were some privacy concerns, you had to get some clearance.
Patient confidentiality and the treatment of the patient, and the patient themselves comes first, above everything. So the first step was to find a consultant who would be happy, and his team who would be happy for us to do this. Then he had to identify a patient. Now this takes a while. The patient actually chose to remain anonymous, which was absolutely fine, but we also wanted to take the patient's family through what we were doing as well. This isn't just about the individual who's undergoing the procedure. Because it's live and because it's social media and because lots more people will view it, we wanted to explain to everybody who was going to be connected with the procedure what it was about, what we were trying to achieve, and also back it up with, if there was an unforeseen circumstance, we needed to make sure we had a plan and we were in control to be able to talk to the patient, talk to the patient's family, and then talk to the social media audience who were following it.
And logistically, it seemed to work very well. I saw the Storify episode, and I saw the videos and the photos. Logistically, how do you feel it went, and how does the hospital feel it went?
Well, logistically, we were very happy. What happens is, yes, there's a huge amount of consent that has to be achieved beforehand, which is a lot of office-based work. Then there's a lot that has to be organised with the consultant, because procedures do go through a process. So we learned what the process was, we made sure we could say the right words correctly in the right order and spell them. And then Holly here was in the operating theatre herself, doing the live tweeting and taking the video from Vine.
Yeah, Mr. Nejad was absolutely fantastic, and he advised the best stages for the photos and videos to be taken. I made sure I sat with him before and understood the procedure, but also understood it in a way that I could get it across to the general public who didn't perhaps have a clinical background.
Yeah, it looked wonderful. It looked really, really good. And what did the hospital think the major benefit was?
Spire Bushy is situated in London, just outside of London, and it competes with a lot of internationally acclaimed hospitals. For them, the major benefit was showing a complex procedure that's only carried out at about 2 or 3 hospitals in the UK, but being able to take it to an audience who could learn more, and to journalists and opinion formers who can discuss it more, and to really show it also off to key potential patients who might follow it and engage more with the hospital. It opens the door, doesn't it, to the operating theatre. Nothing else really does like that.
Right, right. And so the feedback was good. And are you going to do some more of these?
Very much so. Live at Bushy, we want to continue tweeting operations. Spire Bushy Hospital is right behind us, and what we're trying to do is line up some of the key consultants who are themselves sourcing interesting patients who consent and who want to talk. And as I say, the next patient, we're doing a Visionaire knee replacement, which is a bespoke knee replacement made. The prosthesis is made individually for that patient, and that patient doesn't wish to stay anonymous, and she's very keen to be able to talk. So every live tweet we do, we're going to add another new element to it. The next one, it's hoped to be far more from the part of the patient as well as also from the clinician and the supporting team.
That sounds wonderful. Felicity and Holly, thank you so much for sharing this. We report a lot on healthcare social media, and we congratulate you and Spire Bushy for taking this big step forward. Thanks. It was
Thank
great.
you very much.